Hello, everybody. Happy Thursday. This is Dr. Marlene Tages Cordova, and this is Oh Health by Dr. T. This is a show that is meant to educate you, inspire you, and motivate you to take better care of yourself, mind, body, and soul. And today we have an hour show dedicated to diabetes and type 2 diabetes mainly. That's the adult onset diabetes and pre-diabetes. I've been practicing for 23 years, and this is still an epidemic. It is very reversible. It is very treatable with diet. And I realize a lot of my patients don't really know how to eat when they are diagnosed with pre-diabetes and type 2 diabetes. And so this show is for you. It is live as well, so if you have any questions, you can join and ask any questions, and we will answer you. With me today is an amazing nutritionist, Diana Mesa. Are you there?
Hi, thank you so much for having me back. It's a pleasure to join you today. I'm excited to talk a little bit more about, yes, absolutely, one of the biggest epidemics, I think, especially here in the United States. So it'll be a good opportunity to learn a little bit more. We'll talk about some different sorts of foods that we can enjoy without so much depriving ourselves, and we'll understand a little bit better all about these concepts.
Yes. So what is pre-diabetes? So we do a physical exam and we get a fasting blood sugar, and pre-diabetes is anything from 100 to 126. Let's just put it that way. Even though the literature is saying we would rather see a fasting blood sugar less than 90. Would you agree?
I would definitely agree. I think, once you start seeing that increasing blood sugar, it's a telltale sign of insulin resistance. So even though you're not within those numbers yet, that range, it definitely is indicative that the body is starting to stop responding as efficiently to that hormone.
Yes. And so it's an early sign. Pre-diabetes is an early sign that you are becoming resistant to your own insulin. And we're going to talk about that in a moment. So make sure you get a checkup every year and get screened for diabetes and pre-diabetes, because early detection is key so that you can reverse it and prevent yourself from ever developing type 2 diabetes, because that would be ideal, right?
Absolutely.
So blood sugar ranges are from 100 to 126, with an A1C also out of the normal range, higher than 5.7 to 6.5. So if you're in those ranges, it's pre-diabetes, and it's time to address the diet. That's why we have our amazing nutritionist here today, because it's time to change this and reverse this process through your nutrition and through exercise, of course, and reducing belly fat. So diabetes is defined as a fasting blood sugar higher than 126 and an A1C higher than 6.5, right?
That's right. That's right. And those are definitely the numbers that we're looking for, right? At least I know that's a huge population that I see, mostly because that's where the insurance is reimbursing right now for nutrition services. And that's, a whole topic in and of itself.
Oh, yes. Thank you for bringing that up. I cannot send a patient to a nutritionist unless they're actually diabetic, or not if they're pre-diabetic.
Absolutely. There's a lot of insurances that don't cover that. Where I work, actually, we do see a lot of pre-diabetics. So luckily we have some coverage there. But for example, obesity, that is a risk factor in and of itself. And you don't necessarily have to be diabetic or pre-diabetic. You may not have that, disruption in those blood sugars just yet. But like you mentioned, with that increased waist circumference, that runs a high risk of just that insulin resistance in and of itself. Because once we have that increased belly fat, then we start feeling all of those inflammatory effects. Insulin is a growth hormone, so it will promote growth. It will promote fat storage instead of fat burning. So that's why we want to keep those blood sugars under 100, so that we don't have to kind of produce all of this insulin. The more we have these uncontrolled levels of blood sugar, the more insulin the body starts producing, and that's where that whole cycle comes in, where you become more insulin resistant. And that process over the course of the years, with some habits that might not be helping, some lifestyle factors too, exercise, because that's going to be a big one. That's our only other mechanism of controlling our blood sugar, really, aside from insulin, and of course what we choose to eat. So yes, I digress, but I could continue talking about this. I don't know if there's any focus that you want to talk about next, Dr. T.
Yes, we're going to start by defining prediabetes and type 2 diabetes, which we have. And then we want to proceed. What's the first step to do? Let's say you have prediabetes. Take action right now and evaluate the diet. So you have to start keeping a food log. We're going to get into the foods that should be avoided. Immediately cut out certain foods. I tell my patients right away to cut out all sugary drinks, anything that you're drinking that has any sugar in it. And often I have to tell people to stop their fruit smoothies.
Oh, yeah.
We'll talk more about how fruit smoothies, it depends. But if your blood sugar is telling us that you're pre-diabetic and now you're developing insulin resistance, that is a huge common issue I have in the office. They think they're doing something healthy with the fruit smoothie and they're not. And that's often the cause. And then when they stop it, their blood sugar normalizes.
I see that a lot. Absolutely. I couldn't be more with you on that. That is a huge sort of misconception that a lot of our patients do have. Of course, we do want you to pick the whole foods, the real foods, the less processed, the better. However, with that said, there are some foods that do provide carbohydrates, and that will impact the blood sugar. So when we have this insulin resistance already, what we want to do is we want to limit in a way and also combine the foods that we eat that are carb based so that the impact is lesser on our insulin response. What we're trying to avoid is sort of like a spike in blood sugar. And what happens is that, sure, give us some really good vitamins, minerals, some fiber, but it's still a good amount of carbohydrates as well. So a lot of the times, I do have patients that like to snack on apples and bananas, and before the end of the day, they've had 3 or 4 servings of fruit, and that could, a banana has about 32 grams of carbs, and like I said, it's not necessarily a bad thing, but when we already have this insulin resistance, that is where it presents a problem. That's when we start talking about portion sizes and pairing foods. That way we're not having just that carb so that it's absorbed. We want to pair it with a fat. We want to pair it with a protein so that the impact is less on the insulin in response.
Perfect. So my patients have a common question of what fruit can we eat? So there are fruits you can eat that have a lower glycemic index. So can you explain to everyone what is the glycemic index of a food?
Absolutely. Okay, so the glycemic index is an excellent tool. Of course, we do have to keep in mind that the glycemic index is a measure of how that food will affect our blood sugar when it's eaten by itself. This does not take into account other factors like when you have it in a salad or when you have it as part of a whole meal. The impact lessens when you do combine it with the right things. So the fruits that are recommended that are lower on that glycemic index are going to include the berries, things like kiwi, maybe even some mandarins. Once you start getting into the oranges, the nectarines, the peaches, those tend to increase a little bit when it comes to the carb content. Of course, the tropical fruits, although they are very delicious, they are very rich in carbohydrates. So, those should be enjoyed sparingly. One of the things that I like to recommend if you will be adding fruit to your smoothie is to just pick one and keep it to a small portion, maybe a half a cup. Depends on what you're choosing. For example, berries can go a little further because they are lower on the glycemic index. So for example, you could do like a cup and a quarter of strawberries, and that would be the equivalent of half a banana. So there you have an example of how the lower glycemic fruits can go a longer way if you want to enjoy a little bit more fruit in your smoothie. That is to say that because they are lower on the glycemic index, they won't be as sweet. So you might need a little bit more to get to that sweetness that you're looking for, but that's okay when you're picking, the berries. Berries also have another compound in them that help regulate blood sugar too. So they've got this excellent compound called anthocyanins, and that's what gives them those wonderful red, dark colors. And there's some research that supports that, after a carb heavy meal, some berries would actually minimize the impact of the blood sugar. So that's just some food for thought, so to speak.
Yes. I think that the berries have the lowest like glycemic index. And if you're going to eat bananas, you just have to have half. It's about portions, right? Do you have a
Absolutely.
slide about portions?
I do actually. Would
An
love to.
example of how the plate should look?
Yeah, that's a very good tool there. If we can pull that up, that'd be great. And we can talk a little bit more about the proportions on the plate. But in the meantime, I can talk a little bit more about that. Well, so the plate, what we're aiming for, so that we have a nice balanced meal. We want to imagine that the plate is divided into half. So half of that plate should be vegetables, and the more colors that we include, the better. Here we go. So we've got the perfect example here. We see that half of the plate should be veggies. And we see some fruit in there too, but really I want the focus to be on the vegetables, the non-starchy vegetables. These are going to give us all of the micronutrients, so the vitamins, the minerals, all of those excellent antioxidants that are going to help with other mechanisms in the body. They're going to help fortify the immune system, and we're going to see the metabolism just using those vitamins and minerals that would otherwise not be existing if we didn't include all of these wonderful fruits and veggies. So then we also have that portion of protein. So that's about a quarter of your plate protein, and another quarter of your plate just to keep it safe. That way you're not having to measure things, because I know that, it can get a little bit tedious. Here we go. It can get a little bit tedious to measure, your portion of rice or your portion of pasta, just so that you have a good visual and so that you have an idea by simply looking at your plate. You can keep in mind that a quarter of your plate, no more than a quarter, should be that whole grain. Or in the case of starchy root vegetables, you can also include the starchy root vegetable or the legume there. Any sort of that whole food carb based option, starchy based option that you want to, as long as it's within that quarter of your plate and you have enough fiber and you have enough protein in there to make that a balanced meal. I see we have a question. What sweetener? This is from Vivian. Hi, Vivian. How are you? What sweetener should we have in our coffee if we have a few cups a day? Okay, so that's a great question. So that'll range. That'll range from, depending on your taste profile. So if you want to know the sweeteners that'll have the least impact on your blood sugar, two more popular ones that are, I guess, the least processed and the ones with the least sort of secondary effects, I would say, are stevia and monk fruit sweetener. Those two are the better quality ones, I would say. So if you're having a lot of coffee and you want it sweetened, you can do some stevia in there, and it won't be that it won't impact your blood sugar that much. So that should be fine. Something that is on the lower end of the glycemic index, where you can get away with having a little bit of, would be some raw honey. Raw honey is actually lower on the glycemic index when we're talking about that scale than, for example, white sugar or brown sugar. A lot of my patients also mention, I'm opting for the brown sugar instead of the white sugar because I hear that it's better for you. When it comes to how processed it is, it may very well be that the brown sugar is less processed than the white sugar, but at the end of the day, the body is still sort of absorbing it at the same rate. Really, there isn't much of a difference. So you're going to get that same sort of spike in your blood sugar. You're going to get that same insulin response, where it's sort of like a roller coaster. And we're trying to get away from that, because that doesn't promote fat burning. On the contrary, it's going to trap the fat into the cells, because remember, insulin is a growth hormone. So what it wants to do, it wants to build, it wants to grow. And so having those elevated levels of insulin all the time is not going to be a favorable state for your body to be in.
Perfect. Thank you so much. Yes, that's a common question. What kind of sugar? And some people think organic sugar is somehow healthier than regular sugar too. So it's all the same. The bottom line is really starting to document. There's some apps that I tell my patients to download. There's a lot of apps right now. I think the number one step is awareness, journaling exactly everything you're eating. And then the next step is just documenting it and showing it to your doctor, showing it to your nutritionist, because we can tweak it and you'll really change the numbers with some few tweaking, like she said, like the plate. With a couple of tweaks on the proportions on your plate, you can really transform and reverse and heal from prediabetes and even get off of medications. I've gotten patients off of their insulin, helped patients because they're doing all the work. I'm guiding them, but they've been able to take themselves off through our guidance with their food. Food is medicine. It can hurt you or it can help you. It can help you heal, right? That's why Diana is a nutritionist. She knows this. She helps people heal and recover from type 2 diabetes, obesity, which is a huge risk factor. It's a risk factor to develop type 2 diabetes. And belly fat is something that we have to measure because you can weigh a lot and be all muscle, okay? Or you can weigh a lot and be a higher percentage of body fat, that it's an unhealthy percentage of body fat. And if it's most of it is around the belly, that's what creates insulin resistance and puts you at risk, and high blood pressure and other things like that. So we want, but that's preventable. So we want to just reverse the insulin resistance loop. We want to catch it early detection and early prevention by getting your blood work done. So we want to know your fasting blood sugar and your hemoglobin A1C when you go see your doctor, when you go get a blood test, and you want to nip it in the bud. You want to just reevaluate your diet right away. So fruit is huge. She mentioned already the best choices for fruit because there are better choices for fruit. And then she mentioned already portion control. So if you're going to have fruit, have half a cup of fruit at a time and fill half your plate with vegetables, green leafy vegetables, not the starchy vegetables like corn, right? And other starchy vegetables. What else should they avoid in terms of vegetables? I'd like for you to maybe expand upon that.
So there's a few sort of root vegetables. Typically, it's going to be the root vegetables that are going to have a greater impact on our blood sugar. Again, it's all about the portion sizes and how we're combining things. So obviously, if we're going to have a half a plate of potatoes, that's going to have much greater impact on our blood sugar than if we have a quarter plate of potatoes. And even more so if we pair those potatoes with a nice lean piece of meat of your choice. It could be fish, it could be chicken, it could be tofu. And if we pair it with a variety of vegetables, the leafy green ones are excellent. They're going to give us all of those wonderful vitamins and minerals, but also it's important to have that spectrum too, because all of the different colors are going to provide different vitamins, different minerals. We've got the vitamin A, we've got the red, the yellow, the orange veggies. You're going to find a lot of that in there. And then the vitamin K is going to be found in those leafy green vegetables. And that's a very important vitamin for sort of coagulation, so blood coagulation. And, you know, that's something that we have to keep in mind as well, because strokes are a huge risk factor. Actually, diabetes is a risk factor for stroke, but it's also considered the equivalent of if you've already had a heart attack when you are diagnosed with diabetes. So that's just to give you an idea of how important it is to manage that blood sugar.
Yes. Thank you so much. Yeah, so portion control is huge, everybody. And how much sugar you have at the end of the day, starting to document, and a lean protein, fish, chicken, all kinds of, you have another slide you want to share?
Sure. If you want to talk about maybe some dietary and lifestyle changes, because I think that might be an important, aside from the portion controls. I know that I don't know if you get this. I'm sure you do. I get a lot of the patients that are interested in more of like a keto style diet and want that quick weight loss. And I do want to encourage the patient that wants that sort of approach to talk with their practitioner and get get the guidance that they need, because in specific cases, and if done under medical supervision and under the guidance of a dietitian, it can be done successfully if we have some severe sort of like metabolic interruptions there that need something drastic. But really, if you are at the stage of prediabetes, or even when you see sort of that fasting blood sugar climbing up, or if you don't know that your blood sugar is climbing up, and you see some maybe some belly fat, which is usually where it's pretty indicative of insulin resistance, then that would be a good idea to start incorporating those portion sizes. So like Dr. T mentioned, there's a lot of different apps now where we can track our intake. That way we can have a good idea of what we're consuming, because a lot of times we don't even know that we're eating a carb. A lot of the times, like with the example with the fruit, it may not even occur to us. For example, dairy, cow's milk, for example, has sugar in it naturally. It's just the lactose that's found in milk. So that's something that'll have an impact on our blood sugar. And that's why it's so important to get that information and to meet with the dietitian and with your doctor to get that information, to get that knowledge, so that you are preventing any sort of further decline if you are in that pre-diabetic stage.
Thank you. Yes, we mentioned lifestyle habits. So we already have you journaling what you're eating. The next thing is we need to get you to exercise. The most impactful exercise for prediabetes and type 2 diabetes is resistance training. Having to build a muscle really uses up the sugar in your bloodstream, number one. Number two, it makes you less insulin resistant. It increases insulin sensitivity, which is our goal. We want to make you more sensitive to your own insulin so that it works for you, keeping your blood sugar normal. Can you expand upon that too, the exercise? That's what I recommend to my patients. Strength training is the key, about half an hour, 30 minutes, 5 days a week, consistently. It acts like a drug. I tell them, consider your exercise program a drug for diabetes. And if you stop doing it, you have stopped that drug. And sometimes I'll have a patient like, what happened? Your sugars were great 3 months ago. And then all of a sudden they're out of whack. And they'll be like, I eat the same. I'm doing everything the same. And I'm like, really? Were you exercising and then you stopped? And I'm like, come to think of it, I did stop exercising. And I'm like, well, you just stopped that drug.
Yeah.
That's a drug for type 2 diabetes and prediabetes and high blood pressure and many other medical conditions. Actually, it acts like a drug. It's a drug for depression, anxiety. It's a medication, a lifestyle habit that I consider a medication that's very effective without any negative side effects, So consider, everyone, your habit of exercise as a medication and part of the treatment plan for prediabetes and type 2 diabetes, and just staying healthy and well in general. Anything you want to say about that? Any other lifestyle habits?
I agree. I think exercise is a big one. I also recommend the 5 days a week, 30 minutes session as much as possible. You work up to that. It's not something that we do expect you to do overnight, but we do definitely want to work up to that. Other lifestyle factors, smoking cigarettes, that's a really big one. And that just causes some overall inflammation, which is not going to be beneficial because we already have an inflammatory state once we have sort of this excess of insulin floating around the body. So smoking cigarettes is a big one. That's something that if you're still smoking cigarettes, I would really try to seek some help to get off of that, because that's just not good for really any disease state. And if you think about it, the disease states are all kind of based in inflammation and whatnot. So we want to minimize that sort of toxicity that we're inputting into our body when we smoke a cigarette. That's another lifestyle factor that we should consider. And then also stress. Stress is a big one. And I know, Dr. T, you are the expert in this area with breathing techniques, meditation, mindfulness. These are all sorts of practices that we want to incorporate into our daily lifestyle, because in the same way that stress affects sort of like your heart rate and whatnot, that's going to send your nervous system into a whole different state. And what you're going to do is the body's going to produce these hormones that are going to secrete their own glucose to address the sort of stress that you're under, the fight or flight response. And so that's something to keep in mind, because if we're already insulin resistant and we already have these elevated blood sugars, the last thing we want is to increase them by causing more stress to our body.
That's a great point. Always in the discussion is stress.
Always.
Meditation, journaling, and mindfulness, being in the present moment, connected to peace and love. What can I say? Love's the best medicine. And laughter. Laughter is the best medicine. So call your funny friend up and say, make me laugh. Okay, when you're feeling stressed out and overwhelmed, just like in a second, you'll snap out of that stress mode and into that present moment where your body works at its best. Cortisol is a hormone secreted by stress. It'll disrupt insulin levels and just add another layer of risk to the situation. So always in the conversation, thank you for bringing that up. And I'm sure you discuss that with patients too. Even while you're eating your meal, to take a deep breath and take a moment to be grateful for that meal. I call it having a mindful meal. Being grateful for whoever prepared it, yourself, a loved one, all that it took to get that food on your plate, sitting with that feeling of gratitude, being in the present moment and eating slowly and enjoying the colors and the textures of the foods, tasting every bite, really helps you digest all the nutrients. Studies have shown that helps you digest all of the micronutrients more optimally, and also helps you break it down slowly so that you don't really spike up the blood sugar levels. You keep your blood sugars more normal, more harmonized, and more easy to manage by your body. So keep that in mind whenever you have a meal. Try not to eat in a rush. And things like that. Mindful meals make a big difference in how you digest, how you absorb the nutrients, and how you metabolize it. It can help you lose weight, to stay in the present moment, connected to peace and love and gratitude and joy and laughter and all that good stuff that makes life so good to enjoy. Diabetes is affected by stress and your environment. Now you know how to prepare yourself a plate of food, about portion control, about the better fruits to choose, the lifestyle habits, exercise, sleep. Sleep is huge. Resting at night helps regulate insulin levels and cortisol levels. Okay, that's why they call it get your beauty sleep. You can lose weight in your sleep if you do things correctly. One of the things that we recommend is not eating after 7 p.m. I tell my patients not to eat after 7 p.m. because that same meal you eat before 7 p.m. will be digested and metabolized differently than after around 7 p.m. Give or take an hour. There's a lot of studies being done on this because your insulin sensitivity changes later at night. There's a lot of people staying up late, watching Netflix, eating snacks, and that puts us all at risk. So I have a general rule of thumb. You know what? We're catching this early. Start changing the timing of your meals. Keep it earlier than 7 p.m. And a lot of things do get better just with that rule of thumb. The other thing also that I recommend is something called intermittent fasting. Can you expand upon that, Diana? Intermittent fasting. I like the 16-8 routine here. 16 hours fasting, 8-hour window of time to eat. I have been really able to help my patients reverse and heal from type 2 diabetes and prediabetes with that. Can you talk more about that?
Absolutely. I love intermittent fasting. I think that a lot of our patients have a hard time between work, real life, and whatnot, keeping a regular schedule. And a lot of my patients, they say that they actually prefer the intermittent fasting times. They fit better with their lifestyle. And so the idea behind that is to eat around the circadian rhythm, so the natural circadian rhythm, because as the sun rises and it sets, the human body secretes all of these different hormones that are responsible for our sleep cycle, like melatonin. So once that light starts kind of reducing and we start getting sort of the moonlight, that's I want to bring up some research. There's a doctor doing a lot of research on these sort of time restricted feedings called Dr. Sachin Panda, and he's got a whole application where everyone can participate and track their intake, take pictures of their meals and whatnot, because they're doing this sort of whole worldwide study on how intermittent fasting and time restricted feeding is affecting health and all of these health parameters like blood sugar. So yeah, that's the idea behind intermittent fasting. I love the 16 and 8 one, which what that means is that we'll be fasting for a period of 16 hours and eating for a period of 8. So if you really think about it, if you are not really eating anything after dinner, you should probably have a good 12 hours of fasting already. A lot of my patients that want to get into intermittent fasting and are not ready to commit, I do recommend that they just kind of observe the 12 to 12 window first, because that's the most natural thing that we're already doing. If you're sleeping the 8 hours, probably 2 hours before, 2 hours after, you got 12 hours there of fasting. But the 16-8, that one definitely shows the most results. That's going to address the insulin resistance. It's also going to address some of the leptin resistance, which is that appetite hormone. And sometimes with the insulin resistance and the obesity and whatnot, that's going to increase our resistance to that leptin hormone. And that's why, those hormones are actually very related to each other, insulin and leptin, and they're going to control that sort of ebb and flow of appetite. And when they're both out of whack, then we have all of these different eating patterns and all of these cravings. And so that's something that we're kind of nipping in the bud with this intermittent fasting cycle. So I love intermittent fasting, and if it's done with supervision, also considering the medications that you're on if you're already a diabetic, that won't put you into hypoglycemia and drop your blood sugar too low either.
Thank you for bringing that up.
Absolutely.
That's a fear. That's a fear of many patients will have dropped too low. Actually, if I get into agreement with a patient, I know they're going to begin this, it works. And I'll have to see the patient sooner than 3 months, because I know I'm going to start lowering some medications before the 3 months is up. I have them checking their blood sugars, and I'll be able to reduce medications, reduce amounts of insulin sooner than 3 months while they're monitoring their blood sugar. So food is medicine. How you eat, when you eat, how much you eat, all of that matters. That's why we're having this show today, education, right? My patients just don't know what to do, and I hope this is helping them. I love intermittent fasting because they also start to have more energy. They start to also lose weight. So you're getting your sugars under control, but you're also beginning to lose that belly fat, which is very hard to do in our 40s, 50s, 60s. It can be very challenging. Intermittent fasting has been able to help us do that, reduce the belly fat specifically, and you get better sleep. It also increases growth hormone, which is an anti-aging hormone that slows down the aging process. Doesn't really stop you, but it can slow you down, which is something nice that we all like. It gives us more energy, even gives elevated mood. We have report better moods when intermittent fasting, better sleep as well. So there is a long list of benefits, and just talk to your doctor or your nutritionist about it so that you can know when's the best time to implement this. What's the best 8-hour window? I help patients come up with the best 8-hour window for them according to their lifestyle. So it does depend on your lifestyle, what hours you're working, what hours you're sleeping, and then the doctor or the nutritionist can help you figure out what's the best 8-hour window. Also, you can wean yourself onto it, like she said. Start with the 12 and 12, and then work your way up to 16 and 8. Mentioning leptin is so important. I have in my office a natural supplement that helps patients manage leptin levels, and I call it the Appetite Crusher, and you can find it on my store and my website. And I also have something called Perfect Sugar. Perfect Sugar has some natural supplements like chromium, picolinate, and cinnamon that really help our own bodies metabolize blood sugars and maintain insulin sensitivity, which is our goal. We want our own insulin to work for us. Along with the diet and the types of foods we eat when we eat, there are some supplements that can help us while we're on this effort. Want to expand upon any supplements that you also recommend your patients?
Well, I think that the two that you just mentioned, the cinnamon and the chromium, those are the two, I guess, most well studied when it comes to that. Something else that comes to mind is actually a soluble fiber that is used very often. Actually, it's I don't know if you're familiar with the product Miracle Noodles. It uses the same starch. It uses a starch called konjac root. And so
That's great.
yeah, this konjac root is actually also being sold now as a supplement. It's a supplemental fiber that, you know, it won't be absorbed. So it's going to help the patient
Fullness.
rather, correct, feel full. And so that's what we're after when we're talking about these sort of soluble fibers to feel that,
Yes.
that satiation, right?
Yes, that's so important. And also alpha lipoic acid and even green tea. Green tea helps us with insulin, blood sugar, green tea extracts. That's all in the perfect sugar formula. So if you want to know more about that, all the information about that, even the research on that formula is on my website, ohealthnow.com, and the store. It's called Dr. T's Perfect Sugar. Along with diet, of course, and exercise, there are some supplements that are natural and have no negative side effects that can really help you start coming off the prescribed medications and insulins and things like that, and onto, and eventually you can even come off the supplements as well, because these are temporary while they're helping you. Because once you get down to your healthy weight and you've got some nice muscle tone, because the more muscle tone you have, you don't have to be a bodybuilder, okay? But if you just pay attention to your body on a 30 minutes, 5 days a week, stretching, toning with different resistance training exercises. It could be your own body weight. It could be with weights. It could be with resistance bands. Keeping your muscles toned and strengthening exercises is going to keep your blood sugars normal. It's going to really help you prevent type 2 diabetes really for the rest of your life. You can really prevent from ever developing that with your lifestyle habits, your nutrition habits, and stress management habits too. Staying connected, being in the present moment, the practice of meditation. I also have information on that. There's actually a free meditation on my Instagram on a link in my bio there. If anyone's on Instagram, you can go check it out. It's a guided meditation to get everyone out of stress mode into peace mode, where our bodies regulate blood sugars the most optimally. Diana, do you have any other information you have to share on a slide? I think there's some other slides. You can put it up there and we'll just kind of go over it. Any other slides that she so kindly presented for this presentation. We went over lifestyle habits, portion control, the best kinds of fruits, glycemic index. I wanted to define what that means. It's really just an index that is given to every food that tells us how much your insulin, how much insulin has to be secreted by your pancreas to metabolize that particular food item. That is called the glycemic index. So, like a banana basically is going to make you secrete a certain amount of insulin, and some blueberries is going to help you. Okay, blueberries are down here, bananas are up here, mangoes are up here. You got to watch the mangoes. It's mango season.
Mango season, yep.
Who has diabetes? I'm like, have you been eating mangoes?
I want to. I know that's my dad's case. He, you know, actually, it's a funny story. I'll bring this up. He doesn't usually come to me for advice. You know, family members. But it is mango season, and they have a lovely mango tree. And he actually did come to me for the first time recently because his blood sugars were quite elevated. And after doing a 24-hour sort of intake review with him, turns out he had 2 mangoes for lunch. I was like, well, no wonder. And so it's those kinds of little details that sometimes the patient doesn't even realize they're doing, because mangoes are.
Think it's healthy.
Yep, absolutely. So that's why it's important to have somebody kind of looking over that for you.
Food journaling, exactly. Like all day long, I'm like, what did you eat all day yesterday? It's funny because I'll be like, I don't eat dairy. And I'm like, okay, just tell me what you ate yesterday.
Yogurt.
And then I had a cheeseburger and I had a yogurt for, and I said, okay, you are having dairy. Oh, okay. Yep. So it's really awareness first, awareness and assessment. And there's no judgment in this. This is really a learning experience. It's an educational experience for yourself, really, because in the end, we have to learn how to best take care of ourselves. And the way that we eat is one of the best ways that we can take care of ourselves. So you can have half a cup of mango. It's okay. Just don't eat 2 mangoes.
Exactly, exactly. Especially if you're having it for a dessert. Like if you're having a nice balanced meal, let's say you have a nice salad for lunch with some extra virgin olive oil, maybe a little bit of avocado in there for the healthy fats. You can add some, chicken breast, whatever you want, whatever, some shrimp, some salmon, and then you follow it with a nice half a mango, or even throw it into your salad and have like kind of like a mango fruit salad. That's a good idea for, that's optimal balance there. You've got your healthy fats, you've got your veggies, you've got your lean protein, and then you got a little bit of carb there that's not going to shoot your blood sugars up because you're really only having a small portion and as part of a whole and balanced meal, which is the key here. We want the carb to kind of be a supporting actor, not the main act of the show, not the star of the show. So that's what we're looking at.
Thank you so much. Yes, it's all about balancing it all out. It's about how much and also what time. Definitely don't eat mango right before bed either. It is better in the middle of the day.
Yeah. Give your body some time, right? Some time to process those sugars and do its thing. Yeah, absolutely. Earlier in the day.
Yes. Yes. So we've covered quite a bit so far. Wondering what else there is. There's so much in nutrition. It's the glycemic index of foods, keeping your plate balanced, half the plate full of veggies, non-starchy vegetables.
Absolutely. I wanted to maybe talk a little bit more, if we have a little time, about healthy fats too. So
Go
I
ahead.
think
Yeah,
fats
do
are
it.
going to be a big one, because the healthy fats are also going to affect the cholesterol levels, which are also going to be affected by insulin resistance. And here we go with the whole everything is connected again. So healthy fats that we want to be focusing on, we want to focus on the mono and the polyunsaturated fats. So we want to stay away from the saturated fats, which most of the times will come from animal products, with the exception of like palm oil, coconut oil. Now, it's not to say that all saturated fats are the same, and not to say that they're all bad either. There are certain saturated fats. There's fats found in, for example, coconut oil that have some benefits to them and actually can have some benefits to cholesterol profiles too. But we do have to keep in mind that the products out there, they're going to use the vegetable oils, the canola oils, and the oils that are very heavily processed. And I like to stay away from those because of the heavy processing. It's canola oil, for example, is not a so it comes from a seed that is actually for bird food, and so it's not something that I actually recommend a lot. If you're going to be using oils to cook, avocado oil is a great oil. It withstands high heat. So if you want to do maybe some light frying, if that's still sort of in some of your recipes, you can opt for the avocado oil instead of the canola oil. And that's going to have a lot more benefits for cholesterol, for, that sort of inflammatory profile that we're trying to stay away from. Of course, olive oil is going to be a great one. We also have the nuts and the seeds. So, the flax seeds, the chia seeds, all kinds of nuts, almonds, pistachios, walnuts. They're all going to have excellent, excellent benefits. They're going to have a lot of healthy fats. They're going to have a lot of fiber, and they're going to have some protein as well. So if you're thinking of a snack, a healthy snack would be something like maybe let's say a quarter cup of mango, since it's such a sweet fruit, with some nuts, or maybe a half a banana with some almond butter. That's a good healthy snack with a healthy fat and maybe a carb of your choice that isn't going to be absorbed as readily. Another important thing to keep in mind are going to be the refined carbs. We want to kind of minimize those. We want to focus on the whole grains instead of the refined products like the enriched bleached flour, or the white rice. Those tend to strip the grain of all of the nutrients, all of the healthy fats that are actually naturally found in some grains, the protein, the fiber, and the vitamins and minerals. So if we are opting for that carb in that quarter of the plate, we're going to want to keep that in mind. Be mindful of the whole grains. Opt for the ancient grains like the quinoa or the wild rice. Those will have lesser of an impact on your blood sugar because they will have more fiber. And they're also going to have a lot of other awesome micronutrients like those anthocyanins in berries and other different sort of antioxidants that are provided from the color of the grains that are going to minimize that impact on your blood sugar. So, the fiber, the healthy fats, those are two really big important factors when we're talking about a balanced diet.
Yes, perfect. Thank you so much. So let's review. We talked about portion control, what your plate should look like. We talked about exercise, how it's an amazing medication for diabetes, regular sleep, stress management every single day through meditation, mindfulness, even journaling, writing down every day 10 things you're grateful for can help you regulate insulin and blood sugar levels, believe it or not. You're managing stress and you feel calm and relaxed, your body can metabolize your meal and keep your blood sugar normal much better than if it's in stress mode. So journaling, mindfulness, meditation, exercise, plenty of sleep, and also water. Hydration is key in helping us digest and keep our blood sugars normal. The rule of thumb is half your body weight in ounces of water. So just calculate your weight and divide it in two. And that's how many ounces you need to drink throughout the day. And I always tell my patients, just prepare the amount of water you know that you want to drink while you're awake. And you know that you've got to drink that throughout the day. That really ensures success in the hydration habit with my patients. And plus, you just feel so much better, so much well hydrated, gives you so much more energy. It prevents headaches and fatigue and even achy joints, but most of all helps keep your blood sugars level as well and gives you that energy so that you can exercise 30 minutes 5 days a week and keep track of everything you're eating so that you're aware. Awareness is key. Self-assessment of your food, self-awareness, and don't be hard on yourself. It's okay. It's a learning process. I just want you to know, as many of my patients have never been told before, that type 2 diabetes is reversible. You can heal from type 2 diabetes and you can heal from pre-diabetes. You can reduce medications once you begin to change your lifestyle habits. You begin to change your nutrition, your physical activity, and your self-care habits also. You begin to change that, and your health begins to change along with it. It is amazing. It's magical to see these numbers drop when we see patients in follow-up in the office. It really is amazing. And I love to see the joy in their faces when they see their blood sugar levels normal and their A1C levels normal. They've never been told before that this is possible. They think that they have to stay on insulin and medications for the rest of their lives. They have no idea that they can reverse diabetes and pre-diabetes and heal from these conditions. And we hope this really helps show you how. We do have some slides that we'd like to share with you, and we're trying to get them up, but it's okay. Whenever they get up, we'll start talking about them. And Diana, you have anything else you want to say about diabetes, type 2 diabetes, pre-diabetes?
Yeah, absolutely. I do want to just bring some awareness as to how prevalent this disease is, and not just diabetes, which affects 34.8 million Americans, which is about 10.5% of the population, but also pre-diabetes, which is that's already your body telling you that you are insulin resistant and that you have to make certain changes to your lifestyle, whatever that may be, whether it be increasing exercise, increasing your non-starchy veggie intake, decreasing the added sugars, for example. Here we go. We've got the slides up. So yes, this is just a PowerPoint that I had presented a little earlier. And these are the things that we've already reviewed, the parameters for pre-diabetes and diabetes.
Perfect.
And then, 1 in 3 Americans, that's the kind of the driving point that I wanted to make. 1 in 3 Americans have pre-diabetes, and that's only the ones that are actually going to their doctor and getting these tests done. So imagine how much more prevalent that is when we consider how many Americans there are that don't have insurance, that don't get these regular checkups. But yes, pre-diabetes is as prevalent as 1 in 3 Americans. So we want to keep that in mind when we're talking about that importance. And then we already talked a little bit more about insulin resistance, but here are some of those risk factors: the sedentary lifestyle, the high intake of processed foods, carbohydrates, specifically the refined carbohydrates. Those are going to be the ones that are more readily absorbed. Of course, there's a family history aspect of it. There's also an ethnic aspect to it too. There are certain sort of ethnicities that are more predisposed to diabetes. Medications like corticosteroids can also increase the incidence of insulin resistance. So that's something to keep in mind if you have to be on a steroid for long amounts of time. And also pre-existing conditions like polycystic ovary syndrome, which a lot of women experience. That the etiology is insulin resistance. So, you treat that by treating the insulin resistance. So it's all sort of connected. Here we have that balanced plate again, just to drive this point home. If you aim for this, you see we got the edamame, the plant-based proteins. So make it vary. Have a variety of foods, a variety of vegetables, a variety of lean proteins, and a variety of healthy whole grains or starchy root vegetables, as long as you keep it within that portion size. Consider other options if you are already on insulin and need to kind of back off of it and are ready to make those dietary changes. You can definitely go a stricter route and focus more on the healthy fats if you want to substitute the whole grains for a bit, so that we can kind of shock that metabolism back into shape, because sometimes that's what's needed. You won't be able to burn fat or really see a decrease in those blood sugars if your insulin is constantly high and you constantly have an elevated blood sugar. So really, that's what those slides reviewed. Basically, just talking points that we've already discussed, but it's good to have a visual along with that, so that
Yes.
our participants can see that and have those hard facts, that data on hand, because it is very prevalent, and we want to we want to reverse it. We want to prevent it. We don't want to end up on the metformin or on the insulin or any of those things.
Yes, we don't. We want to stay healthy. We want to learn how to stay healthy. And sometimes it's just the missing link. And this show is to provide education, especially diabetes and prediabetes. It's huge in my practice, and it affects so many people on this planet. And yet it's so reversible and preventable. It's the most preventable of all the diseases. And so I thank you so much for joining us. All your information is there. Diana Mesa, she is there for you. You can make an appointment with her, and she will sit with you and teach you the best way to take care of yourself nutritionally. I call it nutritional medicine. Food
Absolutely.
and medicine. Exercise is medicine, and also what you're thinking about is really good medicine too. Stay positive. Think good feeling thoughts, and your body will also follow along and optimally metabolize your blood sugars. Okay, keep in mind to stay connected to the present moment, to peace, to love, to gratitude. And I'm so grateful for this moment right now that I get to do what I do. I love being a doctor, helping patients return back to themselves and really acknowledge how powerful they are. Then they get to choose to take better care of themselves. You can start doing that at any time along your health journey. You can sort of wake up and say, that's it. I choose to take better care of myself. And one of the first ways is through your diet, just cleaning it up. It's an act of self-love, self-respect, and you will reap the benefits. You will. Your health and well-being, and you'll live a long, healthy life with very little or no medication, and just loving life and enjoying life, having the energy to do it and the body to do it, the physical body to do it. The mind will stay clear with the right diet, better memory with the right diet. We all know sugar affects memory and the brain. And so we always want to keep managing that blood sugar to keep you healthy and well. Diana, any last words? We're wrapping it up.
Just want to thank you so much for another wonderful opportunity to have this wonderful and very necessary discussion, so that all of our viewers can have that information and that education to make those healthy choices that are going to help them overall. So that's what we're here for.
And just one last thing, don't take yourself off of any medications, okay? See your doctor. first. Have them do
Very
the blood
important.
work, and they will put you on a plan to gradually stop the medications if they're open to it. Not all doctors might be open to that, but if you make it clear to them that that is what you want, you can be guided, be in a relationship with your doctor so that they're clear on what you want to do. Say, Doc, I want off these meds. What do I have to do? And this is how it begins. And if you just do that gradually, they will show you how to gradually come off your medications. I just want to make that point. Don't do any of this on your own. Please be in a relationship with a nutritionist and your healthcare provider when you're wanting to begin the process of coming off some of the medications that you're on for type 2 diabetes. Of course, if you have prediabetes, you're not on anything yet, and you can just begin to change your lifestyle, your dietary lifestyle and lifestyle habits like exercise, stress management, self-care like sleep, and things like that. Hydration, vitamins and supplements are what we get to begin. Remember, best for early detection and prevention. We are here for you. Love yourself to health. I hope this helps you learn more how to take care of yourself and achieve optimal well-being, mind, body, and soul. Thank you so much.